Hi.
Hi, is that Dr. So?
Yes, thank you. Yes, it is.
Hi,
Sui.
uh, it's
Hi.
it's Chris Nolan from OzTREKK. How are you?
Good, thank you. How are you?
I'm good. I'm good. Thank you for joining. I just promoted you to co-host, so I think you should be able to share your slides.
Okay. Hold on 1 second. 1 second. Let me. Where is Zoom? No. You might just see. You'll just see some folders that
Yeah,
you can see now.
perfect. I can see your screen now. So if it's okay with you, Dr. So, I was just gonna lay some ground rules for everybody in attendance,
No
and then
problems.
hand everything over to you because we only have 15 minutes. So with that said, good evening, good morning, everyone, depending on where you are in the world. My name is Chris Nolan. I'm the Director of Outreach here at OzTREKK. I'm based in Halifax on the East Coast. And we're fortunate enough tonight to be joined by Dr. Zhe So, who's a lecturer at the Physiotherapy program at Monash University in Melbourne. So I just wanted to let everyone know that we have to stick to the 15 minutes out of respect for there's several presentations this evening. And so with that said, please feel free to use the chat functionality to ask questions. And if we can't get to them, we'll be able to answer them either at the Monash booth or at the OzTREKK booth on the Career Echo platform. So with that said, I will hand it over to Dr. So.
Well, thanks. It's Chris, isn't it? Thank you for that.
Yeah.
Yeah. So yes, thank you for the introduction. So my name's Sui. I'm the course coordinator, I should say, of the one of the physiotherapy programs here at Monash University. So I'm just going to give you a brief overview of what it is that we do here in Melbourne, Australia. I think University of Queensland, you might have heard from them already talking about, their physiotherapy program, but just in case, if you sort of missed it, but just to, I guess, give you an idea of what physios do. So we play a very important role in health service delivery. And most commonly, I suppose, we do help people who have sort of movement problems that either occurs after disease or injury. So we work in a variety of different sectors. So you often see physios working in private practices, in hospitals, community centres, sporting clubs, schools, and also in health departments. So this here is an image of a very familiar role that you might associate closely with physiotherapists. Certainly, it was one of the reasons why I chose to become a physio, because I was convinced I would be the next physiotherapist for the Australian cricket team. But my lack of sporting ability did mean that I quickly had to change my career focus once I got into the course. Some other less familiar roles of physiotherapists you might come across. So we play a big role in sort of aquatic physiotherapy now, where we can treat patients with a variety of musculoskeletal and neurological conditions in sort of using water as a medium. The bottoms two slides, indicate where we work in sort of the more acute setting. So certainly a lot of my colleagues have worked alongside many doctors and nurses to care for patients in the ICU setting or in intensive care, which is obviously very pertinent in the current sort of COVID pandemic climate. We also play a big role in neonatal care. So image of the little baby on the top right-hand corner. And obviously we also work in women's health as well. And there is a growing body of physios now who work with animals or equine therapy, but again, that's a very specialized area of physiotherapy. So certainly not something we would cover in an entry to practice course, but it's something that if it is of interest to you, that you could work in future down the track. So here at Monash, we run two physiotherapy programs. We do have our Bachelor of Physiotherapy Honours program, which we've been running now for sort of nearly 15, 16 years, and it is one of the best physio programs here in Australia. But as of last year, in July 2020, we started a new graduate entry program. So the Doctor of Physiotherapy program, and that's the one I'm going to talk to you about more today. So our vision in terms of the DPT program is really to create sort of skilled graduates with the cultural, theoretical and critical ability to progress physio practice and to make sure that it evolves with the needs of the community. So this is a 3-year full-time integrated program, and it gives you sort of an entry to practice physiotherapy qualification. It is what we call, according to the Australian qualifications framework, level 9. So it's not a doctorate, and you cannot call yourself or use the title doctor, but certainly you can say that you have a Doctor of Physiotherapy degree. So what's so special about our course here? Well, we learn about physiotherapy content from week 1, day 1 in year 1. So the minute you enroll in the program, we start giving you the skills in order to make sort of a physiotherapy diagnosis, to develop a treatment plan independently, and to discharge a patient from care. And these are sort of the skills you'll need in order to register for practice in Canada. So basically you'll have this opportunity if you enroll into our course to basically build on your undergraduate studies, whether that's in sort of biomedicine, in science or in exercise physiology, and you'll have an opportunity to learn from sort of clinical and research experts in a fairly well-established department. We have very, very close links with our clinical partners, so in sort of the major hospitals here in metropolitan and in regional Victoria, so Metro Melbourne and in regional Victoria, and you'll have the opportunity to not only sort of work with other health professionals, so occupational therapists, nurses within the campus, but you'll also be able to complete sort of clinical placements across a broad range of settings and private practices. So we start you off right from the very beginning with lots of sort of practical skills developments, and you'll have the opportunity to work with peers. You'll have masterclasses and sort of one-to-one on-campus sort of practical sessions. We also do lots of sort of small group case-based learning activities. So as an example, you might start, the week with a case where we take you through someone who's had a knee injury. We then scaffold your learning through and sort of provide you with the content around applied anatomy, biomechanics. We then teach you how to assess the knee from a physiotherapy perspective, and then take you through in terms of how to perform an intervention for knee rehabilitation. As we said, because we've been running the bachelor program here now in Melbourne for over 15 years, we've got some really excellent facilities through from our prac classrooms to gym equipment and also sort of simulation with some of the mannequins that we have to allow you to sort of refine some of your cardiorespiratory skills. So where are we located? We are located in the Peninsula campus, so a little bit the southeast of Victoria, or southeast of metropolitan Melbourne. It is a 3-year full-time course, and it starts the intake in July. So our next intake of students will be July 2021. It is what we call an integrated curriculum, so you'll see that you'll only enroll in either 1 or 2 units a semester because we teach the content sort of within that integrated framework. And there's a focus of sort of making sure that you develop your leadership, education and advocacy skills as well. Roughly, we anticipate that you'll have about 18 hours of contact time, but obviously you'll have additional sort of self-study time that you'll be required to do. We start you off on sort of fairly early work integrated learning placements, as well as sort of on-campus based activities as well. So in terms of the curriculum, it's certainly underpinned by sort of these 4 major themes, and you'll work through these themes as the course progresses. And you'll see the themes here. So basically what we're going to get you up to speed on is around sort of developing your personal and professional development skills. We'll hone and refine your skills in communication and interprofessional collaboration. The second theme is sort of around the broader cultural, society and population issues that impact on health and healthcare delivery. Applied practice basically relates to the core competencies that you'll need in order to practice as a physiotherapist. And then in theme 4, we'll build your knowledge and skills around sort of research and applying research, particularly to the issues relevant to physiotherapy practice. So This is the course map that we have for the DPT program here at Monash University. So you'll see that year 1 will start in July and you'll undertake 2 units, and then you'll sort of go through to the second semester where you'll learn about neurological and cardiorespiratory physiotherapy. And then you'll move into sort of the clinical placement units from year 2 onwards. We are aware that currently with the impact of sort of travel restrictions and border closures, what we are able to offer this year in 2021 is that you will be able to complete the first 2 units in semester 1 online, and that will be through a mix of live and on-demand sessions. As part of these units, we do have sort of on-campus practical and work integrated learning sessions embedded in it, which obviously, if you are unable to enter Australia, you will be unable to complete. But what we do have planned is that if you are able to sort of come into Australia by the start of the 2022 academic year, we'll then be able to sort of catch you up with the practical components for you to then join back in with the usual course progression into sort of neurophysio and cardiophysio as well. So as I mentioned, part of being a physiotherapist is sort of making sure that you are exposed to the clinical setting. And within the DPT, we roughly have about 1,000 hours worth of clinical placements and simulated clinical experience. So you'll start all of this experience right from the first year, where you'll have sort of work integrated learning, observational type visits, as well as simulated practice within our practical classes with peers on campus. As part of this, there are sort of requirements around police check, working with children check, and immunizations that you will need to complete in order to undertake these placements. But once you've sort of, enrolled into the course, we can take you through all of those activities. This is just an example of sort of the simulation activities we've developed and refined over the years at Monash University. And you'll have these sessions, like I said, back starting from week 1 in day 1, when you start in into first year of the program. So immersion visits, again, you'll be starting in the first year, and certainly for the first year, you'll be able to observe physiotherapy practice settings in a wide variety of settings. So you'll do a couple of sort of visits through to the different private practices here in metropolitan Melbourne, and then you'll also undertake sort of 2 visits in sort of acute hospital and in sort of aged care residential care facilities as well. So what do you need in order to enter the program here at Monash? You will need an equivalent Australian undergraduate degree in a relevant area of study. So for instance, Bachelor of Biomedicine or Bachelor of Science. And you will also need to have completed sort of studies in the areas of human anatomy, human physiology, and biostatistics. We do say, because it is a competitive program, so you'll need sort of a distinction average as a minimum level to be eligible for the program, and obviously we'll need to meet the English language requirements as well. So again, if you are interested in the course, certainly do apply directly through the Monash website. Just be aware that because we do teach this sort of integrated curriculum, it can sometimes be a bit tricky, and it's tricky for us to award credit for previous sort of studies. So that's something just to keep in mind. If you haven't completed any of the prerequisite subjects, you essentially will not be eligible. So make sure that when you are checking entry requirements, that you not only have met the undergraduate component, but that you've also met the study areas for requirements. So that's human anatomy, human physiology, and biostatistics. In terms of our course, we are accredited with the Australian Physiotherapy Council. So that means that our students are eligible to practice as a physiotherapist once they've graduated from the course. The only thing to keep in mind is that because we are a new course and we haven't had any graduates come through yet, what you'll see is that we do say that we expect full accreditation once our first cohort of students complete the program, because that's sort of the accreditation guidelines that we have to work by. But the course is approved through the APC, through the Australian Physiotherapy Council, and our students will be registered to practice in Australia. So here are some contact details if you are interested. I think, Chris, I might have 1 minute for questions potentially.
Yes, please. feel free to use the chat functionality. Thank you for joining us, everyone, for this evening's session. And if you have any questions, yeah, let them fly. We've got a couple minutes, and also we will have time at both the OzTREKK booth and the Monash booth to answer any questions about the physiotherapy program there.
I can't see any.
Okay, so yeah, right now there's not much in the way of questions. Maybe could you just speak to the student support that's available within your program?
Yep. So here at Monash, we obviously have a big, international student support team that will support international students. We do so. Peninsula campus, we are aware, is a little bit further away, sort of from the centre of Melbourne, but there are obviously, developed facilities here, residential facilities that the students will be able to access, and there's also really good support that students will get through the Postgraduate Association as well, through the Monash Graduate Association. So there's a whole variety of student supports that will be available through to students.
Fantastic. Thank you very much, Dr. So. Really appreciate this overview, and and I think we will carry on. I think we've got the Monash occupational therapy session next, so we're going back to back Monash. So
yes, we are Team Monash at the moment.
And enjoy the rest of your day in Melbourne.
No worries. Thank you. Bye.
Okay, thank you.